Hi, Martha. Hi, everyone. My name's Jose Corchado. I'm the supervisor with the Fresno County Department of Social Services. So I supervise MEDI-CAL, CalFresh, and some of the other programs that we offer here. So I wanted to start off by talking to you a little bit about our lobbies that we currently have here with the Fresno County Social Services. So in this upcoming slide, you'll be able to see that we do have some lobby closures. So in reality, in Metro Fresno, in the Fresno area, we only have two lobbies that are open. Those lobbies are located. One of them is at Millbrook and Shields. It's at our Heritage Campus, and the other lobby is on Cedar and Kings Canyon, and that is in our main building. So in both of these lobbies are open, but they're open for self-service only. So what self-service means is that you're able to go into the lobby, but it's open so that you can self-service. So you can use our copier, you can use the scanner that's there, you can use the computers that are there. So if you need to apply for benefits, and there's also paper applications in a few forms that you can take with you. And but unfortunately, um, you're not able to get assistance from any of the staff there because of COVID. So at this time, we are not conducting any type of in-person interviews at in our lobbies. And also, if you need to get information to us besides the Dropbox, there's also a self-scanner in the lobby that you're going to be able to use and send us that information. So all of our other lobbies are currently closed to the public. The lobby that is at the Fairgrounds building, it is closed to the public, but there is a drop box on the outside of the building that you can also use to drop off information if you need it to. So towards the end of this presentation, I will give you information on how you can access your case information um, besides calling our call center. But if you need to speak with with the live person, then the best thing for you to do is contact our call center at 1-855-832-8082. And you can reach someone at the call center from 7:30 a.m. to 3:30 p.m. Monday through Friday, as long as it's not a holiday. Okay, so we can go to our next slide. So the first program I want to talk to you about is the CalFresh program. So CalFresh is also what was known before several years ago as food stamps. At the federal level, it's known as SNAP. So if you hear CalFresh, food stamp, SNAP, we're talking about the same program. There is no difference in the programs. So with this program, it's intended for low-income households and to supplement your monthly income. So if you are eligible to receive some CalFresh benefits, the hope is that it'll free up some of your cash so that you can pay for other necessities that you might have, such as your mortgage, your PG&E bill, your rent. So hopefully it frees it up so that you're able to use for something else. Now, some of dispel a few myths regarding CalFresh. So some persons think that you have to have a child in the home in order to qualify for CalFresh. And the reality is you do not have to have a child, so you can be a single individual and possibly qualify for CalFresh. You can be a married couple, no children, and possibly qualify for CalFresh. Uh, Another myth is that some persons think that you have to have no income in order to be eligible to CalFresh. And in reality, you can receive some kind of income. For example, you can receive unemployment and possibly qualify. You can be employed, even employed full time, and possibly qualify. So, in order for us to make a determination to see if someone's eligible to CalFresh, we take a look at three things. We take a look at the size of the household, the amount of income that household has, and the amount of deductions that we're able to give to that household. So if your income is under the income limits for your household size and we're able to give you enough deductions, then there's a possibility that you can qualify for CalFresh benefits. The more deductions or the less income you have, then the better the possibility of being able to get you to the maximum amount of CalFresh benefits. But if for some reason you don't qualify for the maximum, you might still qualify for a portion of it, which would still be some help. Okay, and of course, also your elderly disabled persons could qualify if you're a homeless individual. You can still qualify. And college students can qualify, but they have to meet a few more regulations than most other people. So the other program that we have is our CalWorks program. So in our CalWorks program, for this program, it is required that you have a child in the home under the age of 18 in order to qualify for this program. CalWorks is a cash program, so if you are eligible, you are going to receive cash benefits. So those benefits are loaded onto what's known as an EBT card. So the same as for CalFresh, it's also loaded onto the EBT card. So if you receive cash assistance through CalWorks or any of our other cash assistance programs, and you also receive CalFresh, then both benefits, cash and the CalFresh benefits, are loaded onto the same card. At the time of purchase, though, you are able to select which account you want to pay out of. Of course, though, CalFresh benefits, you can only pay for grocery items with your CalFresh benefits. You can't go into, for example, a department store and purchase clothing for your children with CalFresh benefits. For that, you would have to use cash benefits if you have those on the card. Okay, and the same thing, you're able to speak to a worker between 7:30 a.m. to 4:30 p.m. At our call center. Right. So right now the best way of accessing your case information, if you needed to, would be to go to mybenefitscalwin.org or to dsspass.fresnocounty.ca.gov. So either one of these websites will give you 24/7 access to your case. In order to access your case, your case, you will need to know your case number for DSS Pass. So if you have that, when you're in your case number, if you are on CalFresh benefits, it will be the number that's on your EBT card. So that's the simplest way to find your case number. So through either one of these websites, you can actually send us verifications if we're asking you for, let's say, a pay stub, or we're asking for utility bill or anything else that we might be asking for. You can go ahead and snap a picture with your smartphone and upload it and submit it to us through these websites. On both of these websites, you would first of all have to create an account, and then you would go ahead and enter your account and send us your information. Now, the other thing that you can do with My Benefits CalWin is, if you needed to apply, you can use My Benefits CalWin to apply for any of the benefits that programs that we offer, and you can access it 24/7, submit it to us. And just to let you know, for CalFresh, the state, for CalFresh and for the CalWorks program, the state gives us 30 days to process those cases. So if you do submit an application, you should receive a response within 30 days. Normally it's faster than that, but at the longest it'll take 30 days.
Okay. So the program that I'm going to talk to you about is MEDI-CAL program. So this program is it's a health insurance program. This program is designed to get you that health insurance that you need. So just to give you a little bit of history about MEDI-CAL. So prior to ACA, what everybody used to refer to as Obamacare. So prior to this starting, the only way an adult can qualify for MEDI-CAL, it would have to be someone that had a child under the age of 21. Okay, or if that adult didn't have a child under the age of 21, then the only other way that they can qualify for MEDI-CAL is if they were disabled and Social Security get declared disabled, or they were age 65 or over. So when ACA came about, the Affordable Care Act, what it did, it expanded MEDI-CAL to more individuals. There was a new MEDI-CAL program that was created, and it's called MEDI. So now the majority of persons that qualify for MEDI-CAL qualify under this program. So under the MEDI program, you don't have to have a child in order to qualify for MEDI-CAL. You can be under 21, over 21. It doesn't matter your age. Pregnant individuals qualify as well. So you can be a couple no children. You can be a couple with children, or each have your own children, and you can still qualify for MEDI-CAL. So basically for MEDI-CAL, what we look at now is your income. And the income limits are at 138% of the federal poverty level, which was also increased because of ACA. So prior to that, the income limits were a lot less, so less persons qualified for MEDI-CAL. Now there's better possibilities of qualifying for MEDI-CAL because of the higher percentage level of income that you're able to have, and also children have always been eligible to other MEDI-CAL programs. So there can be instances where maybe the parents don't qualify for MEDI-CAL because the income is too high, but for the children, there's even higher income limits, so your child can still possibly be on MEDI-CAL. So you can have MEDI-CAL for your children, but then the adults could possibly be on Covered California, which is also health insurance. And it's all done through the same application, so there's no need to fill out multiple applications. So if you apply for MEDI-CAL, we will evaluate you for the MEDI-CAL program. But if for some reason you don't qualify because your income is too high, then your case will automatically referred over to Covered California, and you're able to get assistance through them if you qualify for Covered California. Okay, and the same thing, if you do apply through Covered California, it's just one application for both programs. If they feel that your income might be low enough for MEDI-CAL, then they will forward your application to us, and we will evaluate you for MEDI-CAL. Sorry about that. We are also attending the evacuation center at this time over at Granite Ridge for the people that have been affected by the fire. So I'm getting calls from there. So I forgot to put my phone on silent. So for MEDI-CAL, we have 45 days to process your case. That doesn't mean that we're going to take 45 days. We are actually processing them a lot quicker. So the best thing to do is if you do apply, send us as much information as possible. So if you're applying for the very first time, we need your social security numbers, we need birth certificates, we'll need income verification if you do have any kind of income, whether it's self-employed income from an employer, part-time, fixed income, for example, a pension or social security, unemployment, any type of income. So if we have this along with your application, at the time when the worker first reviews a case, if they're able to process, they'll process your case right away. If all the information isn't there, then they will send you out to request to get the information in so that we can process your case.